I think that at first, we have to recognize that the younger surgeons that we're seeing today are kind of a different breed from the surgeons that I am and that I grew up with. And so I can't so much fall back on my own experience of what I saw among my colleagues or myself, because I think we're dealing with different times. And so to be very honest, one of the major considerations that I see in a big area of maybe even confusion is how committed the person really is to the profession. And for me, that was reflected in the time that I spent and the choices that I made along the way. And that includes my family as well as, how I wanted to spend my career. Did I want to just have a certain volume and then have a good life, or did I want to have a certain volume and contribute, or did I not care so much about the volume, or I just want a real big volume and have a wealthy life? So I think in today's time, what would be in common with when we were going through these kind of issues, is what is that? Why did you join the profession? What was it that made you want to join the profession? And then the second question is, have I organized my life to achieve that goal? Are you aligned with what you started with? And I think that's something that I see lacking a little bit. The other area that I think is kind of a deficiency that I see that interferes with a person's career, I believe, is the desire to either be famous, make a lot of money, or be important. And I see that in orthopedics, and you would understand this, of course, is wanting to be involved with companies and wanting to be a consultant for a company and the prestige that goes with that. And once you start having that as a goal for what you're doing, or I think you start losing some of the reasons that we should have been going into the profession to begin with. Those are something that happens passively because you are contributing, you are a good surgeon, you are taking care of patients. And then people want your opinion and people want you to contribute, or they want you to join them on some kind of a commercial effort. But you don't go out seeking that. It should all be passive, in my opinion. And what I see in this generation is people seeking that. And if you seek those things, other things have to fall by the wayside. And I think some of that is maybe commitment to patient care. In my career, I've been very fortunate, as you may know, in terms of the recognition I've received and all. I have not, in any instance, asked to be elected this, or would you push me for this, or I want to be the department chairman, would you? Not a single time in my life did I ever ask for anything. And my rule was people should come to you and ask you. You don't tell them I want to do this or I want to do that. And that's something that I do see. I see a lot of people now saying, Dr. Morrey, could you put in a good word for me here? It's not putting in a good word I want to be president of the academy. I've had about 7 people that have told me that. And, how can I become president? That's the question, is how can I do what you did? And my answer is, I don't know. Put your head down and use whatever talent you have and don't look up. And if somebody taps you on the shoulder, then you can look up. Patient care. The most fulfilling thing that I have in my life, and I have been blessed with my career, and I know that, is when I walk into an examining room in a post-operative patient, particularly if it's a lady, and they jump up and hug you. I mean, that kind of says it all. And when a person just expresses their deep gratitude, particularly maybe with a little gift, and I can think of one that it wasn't Australia, but it was down under. It was a South African that I saw, and she was so appreciative. She gave me about a 2-inch high round tusk, elephant tusk. And I think that was an important thing to her. And I know I've been to, in fact, I'm an honorary member of South African Orthopaedics, so I've been there a number of times, just like I've been to Australia. I did my Fulbright travel in Australia. So just to have that small token, it was valuable to her, and she wanted to give that to me to thank me for my surgery. That kind of thing, just you can't put a price on those kind of experiences. And the reason I went into orthopedic in part was to seek that, because I didn't want to be in the realm of a cancer surgeon where all I was doing is prolong life a little bit. And I didn't want to be the bearer of bad news for the rest of their life. I wanted to be gratified that I was helping people and that they were happy and I could get them back to work or get them back to sport. So it's kind of a selfish thing that I went into orthopedics for. But it was really gratifying. It really worked out because that was what my career was like. That's really an easy question and I teach this, I very specifically teach this. The key is to establish a doctor-patient relationship, period. To expand on it though, you establish it on your first meeting. And it doesn't have, I don't think the patient cares quite as much as how good you are, as how approachable you are. I mean, it's the art of medicine. So I taught my residents your very first meeting establishes the doctor-patient relationship. And that even dictates the outcome. Even if objectively it's a good outcome, if they don't like you, they're going to find things to complain about. If they like you, they may have some problems, but they won't even tell you because they're embarrassed because they don't want to disappoint you. And the way I tell them that they establish that is to make sure you touch the patient, you examine the patient, and post-op, and this is what people miss. Every time I went into a room, I never left without touching my patient. I might wiggle their big toe if they didn't have anything that I really needed to check, but I always touched them. I might touch them on the shoulder, kind of like a sign of endearment or so for a lady. And for a guy, you just tap him on the shoulder or so. And what I told the residents, when you use the phrase, when you're talking to them and you're talking about their indications, the phrase that you should never forget is, if you got something, so well, I'm not sure what I'm going to do, I'm going to do a scope, I don't know what I'm going to find or whatever, you're going to say, I will do what's in your best interest. That's the key phrase that you need to leave the patient with. And that will help identify and solidify that doctor-patient relationship. I saw a patient once that was a pretty little girl, 20s or something, and she was in a motor vehicle accident. She'd injured her elbow, and she developed a contracture, not 90 degrees, but about 110 degrees. And so she was a pretty girl. She was walking around here with her arm kind of on her chest, and it's an obvious deformity. And nobody wanted to operate on her. So I thought, well, this is kind of challenging when they get that high up. But I operated on her. What I didn't take into consideration was that when you get a deformity like that, the median nerve can scar into the capsule. So when I released the capsule, I released the median nerve. And so I explained it to the patient. And I called one of my hand surgeons in, and he repaired it, and she got some return, and she got a good return of motion. But fast forward, I now have summons to a deposition. And so the deposition was really about the motor vehicle accident and the recovery and all that. This patient's sister was an attorney. So, of course, there's no way you're going to avoid a suit. The deposition was about the amount of the settlement. And then the other attorney brings in and says, but doctor, how can you argue for this amount of settlement when before your surgery, she had a perfectly normal hand and now she doesn't? And so immediately the sister jumped in, who was defending her sister, representing her sister, and said, that's inappropriate. I challenge that, and that needs to be stricken. I thought, how often do you see an attorney protecting you for transecting their family member's nerve? That doesn't happen very often. But that girl knew. I told her the risk. I didn't tell her specifically that. But my point was, she knew that I really was trying to help her. And even though she had a bad problem, she still ended up a lot better than she was when she started. And she was appreciative. She was appreciative because nobody else would do anything. She's going to go through life with her hand, sucked up. So when that sister jumped in, I thought, boy, that doesn't happen very often. So, but that goes to the doctor-patient relationship. That's the meaning of the story, of course. Weekend. Uh, well, I have 4 children, and I've only been married once, 57 years. And so everything evolves around the family for me. When I was going through the meat of my career, the high points of my career, I only had two considerations: is myself, my own personal profession, and that meant all my patients and my family. I didn't have it. I didn't say I needed time for myself or whatever. So on a weekend, I don't play golf. I did when I was growing up in Texas, but I didn't have time when I matured. So anyhow, it all evolves around now watching the grandkids. I have 3 great grandkids now. Of course, they're just babies. But just today, I was communicating with my son in Rochester. We're back down in Texas about when my grandson's going to be playing hockey because I want to go up and see him this winter. And so a weekend would be with the family, usually doing some sports and just having the family get together. No, we all can't get together; we're spread out, but it's to be with family and my friends, and for evenings and all. So I've tried very hard not to do too much work on the weekend, at least while the kids were awake. That was the other thing. During the week, I'd get home and I never pulled out my briefcase or started any papers or whatever while the kids were awake, but I didn't sleep much. So when they went to bed, that's when I'd pull out my briefcase and get my stuff done. So the short answer is just family activities, which sounds pretty corny, but we water ski on a lake up in northern Wisconsin. We go fishing, but we do it with the family mainly. But let me just share something with you too that I think is so interesting. There was a recent study on longevity, and they studied different categories of activity that would correlate to how long you lived. So they looked at people that had a BMI of whatever. They looked at what the diet consisted of. They looked at the amount of exercise. They had about 6 or 7 things. And you know what the number one correlate to longevity was? Social interaction. Somebody that had a social life outside themselves and outside the family. That's interesting, isn't it? I mean, we all know that's important, but this study showed it had the strongest correlate to longevity than any of the other standard considerations. Well, that's interesting. And I guess maybe everybody will say this, but probably the Bible. And I don't actually mean the Bible as such, literally, but the implication of it is, and by that I mean reading works that cite the Bible or they talk about a way of life. So I can't think of any one book except when I was a senior or junior in college. I read one book that I thought was interesting called The Organizational Man. And it was, I graduated from college in 65, so this was around 63. And what they were talking about is at that time in the 1960s, people, what they were looking for in a job, it kind of goes back to the first question in a way. What were people looking for in a job? And they did surveys and they found that the number one thing they were looking for is security. And then the number two thing they were looking for is the amount of the income. And what resulted in them staying wasn't so much making more and more money or leaving because of money, but rather because of satisfaction. And they wanted to have a chance to move up and to have their efforts rewarded. And so I remember that from that. It was just it wasn't even a course, believe it or not. I just somehow or other got the book and read it. And that had an impact on me too, because I thought, you would think everybody was after the money and all that, but there's other things that are important. And I found security not to be the one that interests me, but what interests me, we've already touched on it, was, I kind of wanted to have, I knew I had a certain amount of talent, and I kind of wanted to make it worthwhile and not be kind of a selfish thing that I benefited from, made a lot of money. But maybe share it with something, and that's medicine. That defines medicine. When I met my wife, I was enrolled in law school, and I was going to go to become an attorney. And then she's a nurse. She's pretty, and she was very dedicated. And so that was what I was looking for. And so I thought, well, I think that's what I'll do. So that's how I got into medicine. And it all kind of goes back to the central question of, what do you want out of life, for God's sake, and using your talents. And what better could you do than being a physician first and an orthopedic surgeon second?